President-elect Joe Biden is set to inherit a country whose response to the pandemic has largely been characterized as a failure. Quick Takes Madison Mills joins me now to talk more about it. Madison, tell us what Biden will do on day one to address this pandemic.
Thanks, Renita. A really just crazy day as we hit over 400,000 deaths from COVID-19 in the U.S. as Biden is on the evening of his first day as president. But there is one specific thing Biden will have to focus on during his first hours in office, and that's something that Trump did yesterday. He lifted travel restrictions from Europe and Brazil. Originally, those restrictions were put in place, of course, to prevent COVID cases from making their way from there to the U.S. Now, Biden aides have said that Biden will plan on reversing that lifting of restrictions first thing tomorrow, but that's just one thing of hundreds of thousands of things that Biden is going to have to get to control this pandemic, right? We also know that more broadly, he's going to be pushing more of a focus on science, a focus on mask wearing. He wants to put in that federal mask mandate, get people to mask up for his first 100 days, and of course, push forward vaccine distribution. So he's got a lot on his plate as he enters the White House tomorrow.
You're right on vaccine distributions, especially Biden. He's promised to vaccinate 100 million people in 100 days. Now, how realistic is that plan, given what we've seen so far with this sluggish vaccine rollout?
Right. I mean, heading into the end of 2020, we were promised 20 million vaccinations by the end of the year and thoroughly missed that goal. So the question is, can this 100 million doses be a feasible goal? And Dr. Fauci spoke about that earlier. I want to play a quick clip of what he had to say about that.
The issue of getting 100 million doses in the first 100 days is absolutely a doable thing. What the president-elect is going to do is, where need be, to invoke the DPA to get the kinds of things we need, whatever they may be.
And today, Dr. Fauci received his second dose of the Moderna vaccine. Him and his team of scientists are working on researching whether that vaccine can actually be doled out to more people. So that would also increase vaccine distribution. And again, as providers just get used to giving out this vaccine, that should also speed up the process as well in the months to come.
And so another thing about vaccines, we know that there's another big hurdle with them at the state level. So what will the Biden administration do to address those challenges?
Right, two big issues that state officials have griped about over the past couple of months are just a lack of clarity around the vaccine distribution. States are not being told exactly how many shots they're going to get. And of course, that makes it impossible to plan, right? You can't get people on deck to take the vaccine if you don't know how many shots you're going to get each week. And that's really concerning because some hospitals are having to throw away vaccines that are unfrozen and then go unused. So Biden has said that he will plan on addressing that. He hasn't been very clear about exactly how he'll increase communication with states, but he's pushed forward that message multiple times that he wants states to know how many shots they're going to get. Now, the other issue is resources, right? Providers just need more people on the ground to actually physically put shots in people's arms. So Biden's incoming CDC director spoke about that earlier. She said Biden plans on reaching out to a lot more people to get them to be the ones putting shots in people's arms. He wants to call on military personnel, medical students, nursing students, even retirees who are on the younger side, and getting them involved in just distributing the shots. So that's something that would also increase our ability to get more and more people vaccinated.
I wonder what that training would look like, Maddie. But outside of the vice or the president-elect Biden, what are we hearing from state officials about how they hope to get these shots into people's arms?
Yeah, I mean, state officials are tired, right? And we're hearing that here in our home state of New York. Governor Andrew Cuomo reached out directly to Pfizer and said, can I just buy more shots from you guys directly instead of going through the federal government, because that process has lacked so much transparency. New York received 300,000 doses one week. The next, that dropped down to 250,000. So Cuomo wanted to just reach directly out to Pfizer. They declined that request, but it just goes to show the challenges officials are facing with vaccinations.
Okay, Madison Mills, thank you very much for joining us and for giving us that update.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.